Hi everyone, welcome back to Annual Conference Live with 0 to 3. I'm Will Halleck. Before we get started, I just want to remind everyone that we're having a giveaway later today. If you go to 0to3.org/annual conference live, we'll be giving away a free registration to next year's annual conference in Fort Lauderdale, Florida, so don't miss out on that. For now, I'm really excited to be here for our fireside chat on parental mental health therapy. I'm here with Dr. Rahil Briggs. She's the National Director of HealthySteps for 0 to 3. Thanks so much for being with us.
My pleasure. Good afternoon, good morning, wherever you are.
And maybe a good place to start would be with an overview of the HealthySteps program.
Sure. So HealthySteps is a program that basically takes advantage of a couple of very important things. Number one, almost everybody goes to pediatrics. Almost everybody takes their kid to the pediatrician. It's sort of the most universally accessed space that we have. Number two, people trust their pediatrician. We know that parents look to pediatricians for advice and really tend to trust what they hear at the pediatrician's office. And number three, you have repeated access. So you may not know this, but in the first 3 years of life, you take your child to the pediatrician 13 times, even if they're perfectly healthy. So you've got this universally accessed, trusted, non-stigmatized, repeatedly accessed platform. Why not add in a child development specialist called a HealthySteps specialist who's going to pay extra attention to the child development, behavior, the parent-child relationship, the parental well-being. They're going to make sure that the practice is screening. So we know that developmental screening and screening for social determinants of health are a couple of really important ways to make sure that families are getting exactly what they need and children are developing appropriately. They're going to do care coordination. So if you need a linkage to an early intervention program like speech therapy, making sure that happens, which is sometimes a difficult thing to navigate. They are going to make sure that folks have access to positive parenting resources, to early literacy resources, and really almost serving as an extension of the physician so that every time you come to the pediatrician, you see your pediatrician and you see your HealthySteps specialist.
Absolutely, thank you. One of the things that you mentioned was the relationship between the parent and the child, and one thing that's core to the approach is the two-generation model. So I was hoping you could speak to a little bit about that. Why is it important also to focus on parents when treating children?
So I would say that's important no matter the age of the children, but it's especially important when they're infants and toddlers. Let's say, for example, that you're trying to sleep train a baby, and we all know when there's a baby in the house who's not sleeping well, it's quite disruptive to the family. Let's say the baby's 9 months old. Do you talk to the baby about how to sleep train themselves? Probably not. You talk to the parent, right? So a very wise sort of giant of this field, Winnicott, used to say that there's no such thing as a baby. And all that he meant by that, I'm sure he meant lots of things, but what I understand he meant by that is that babies exist in a context of relationships. And their primary relationships, of course, are with their primary caregivers. And it really makes no sense at all to try to just intervene with the child and not intervene within that relationship. Let's say that you're, with a family for an hour a week. Well, there's a whole lot of other hours when you're not there. And what's critically important is working with the parent and the child together so that they get that relationship to be as comfortable and as wonderful as they both want it to be.
Yeah, absolutely. And looking at that relationship as well, what are some of the impacts that perinatal mood and anxiety disorders and parents can have on children in that setting?
Sure. So perinatal mood and anxiety disorders, as you said, or PMADS for short, is the sort of overarching category when we talk about things like postpartum depression, postpartum psychosis, which is very rare but always makes the headlines, anxiety. And there's a host of things that happen both for the parent themselves and for that parent-child relationship. For example, we know that parents who are depressed speak less often to their children. I think we can all sort of understand that. When you're depressed, you're not super chatty. We also know separately that the single biggest driver or predictor of child vocabulary is the amount and quality of words spoken to that child. So it's a pretty quick jump then to understand how parental depression leads to, perhaps, child developmental problems, particularly in the areas of communication. In addition, when we think about the role of parents with very young children, the parent is serving to regulate the child. And what we mean by that is, kids get fussy and kids get anxious and kids get disorganized, and it's the parent who comes in and organizes the child, helps to regulate the child, helps to say, it's okay, sweetheart, and this is fine, and you're okay, and it's just a little boo-boo, and here's a kiss. If the parent is highly anxious themselves, they're probably not able to do that regulation. They may convey back to the child that this is a big crisis and it's not just a boo-boo and there is a problem. And as you can see, that's sort of almost a transference of anxiety that can lead that child to become quite anxious themselves. Those are just two quick examples of a real host of things we know happens within this critically important time of early childhood for the parent-child relationship.
And so looking at HealthySteps with this terrific and very cross-cutting approach, can we talk about some of the outcomes that you see from the program?
Sure. So HealthySteps has actually been around for quite a long time. It was started in the 90s, and there was a randomized control trial, or RCT, which is sort of the gold standard of research at that time, that was published in 2003 in JAMA. A randomized control trial basically takes a whole bunch of people and randomly gives some people HealthySteps and some people not HealthySteps, so that you're able to really make a pretty good guess that it was HealthySteps that made the changes for these folks. And we know that there are outcomes in a whole host of areas for HealthySteps. Children were more likely to be immunized on time. Children were more likely to be read to. Parents were more likely to have shared their feelings about depression with someone and received a referral. And in one of the studies, we also showed that depression, when treated via HealthySteps, got better. Doctors are more likely to express satisfaction with their jobs when HealthySteps is in place. And that's something that people don't always think about. But, sometimes physicians tell us, I'm trying to, do everything that I'm supposed to do within a 15-minute visit. Vaccinations, is the child growing correctly? Make sure that we're talking about fluoride and helmets and all this stuff. And there's this issue of the parent-child relationship and parental mental health. That can be a real burnout for them. And when you add HealthySteps in to really either treat the dyad and or help refer them out to the community, it's a huge relief to doctors. We know that HealthySteps can interrupt some intergenerational transmission of trauma. So we have one especially exciting study that showed that for mothers who had experienced abuse or neglect in their own childhood, when we gave them HealthySteps, their children's social emotional development in age 3 was much better and much more healthy than children whose mothers had abuse and neglect but didn't get HealthySteps. We also know, interestingly enough, that even though HealthySteps is not, by definition, an obesity prevention program, we have some great data that shows that children were less likely to be obese at age 5 if they received HealthySteps. And you say, well, hold on, it's not an obesity prevention program. How did that happen? When you think about obesity in early childhood, again, it's part of that parent-child relationship. The baby's not making the lasagna.
And so we have a lot of professionals watching in the audience now, professional caregivers and service providers. And so for pediatric and family care practices, how can they become a HealthySteps site?
I'm glad you asked. We currently have, I think, as of current count, about 130 sites across the country in 19 states, Puerto Rico and Washington, D.C. Later this month, we will head to Minnesota, and that'll be state number 20. But if anybody wants to join our ever-growing and wonderfully expanding network, you just go to HealthySteps.org. And over there on the right-hand side, it says Become a Site. Click on that button. We ask you for basic information, and we will get right back to you and help you get along the process of bringing HealthySteps to your community.
That's terrific. Thanks so much.
My pleasure. Thank you.
You can learn a little bit more as well at 0to3.org/AC Live. We'll be curating some resources there. And be sure to join us for our next fireside chat at the top of this next hour, 4 p.m. Mountain Time. It's going to be on positive parenting. Dr. Briggs, thanks so much for being here.
My pleasure. Thank you, Will.
All right,
Thanks,
we'll see you
everybody.
soon.